Hi guys, in a previous video I spoke to you about my experience with having TURP and how it affected my life and how it took place while I was in the hospital for having just having gallbladder surgery. And then I discovered while I was in there that I couldn't urinate, and that eventually what was decided is that I would be given the TURP, T-U-R-P surgery. And this is part 2 of that, where I hope to talk a little bit more about my recovery from TURP surgery. I'm drawing mostly on memory here alone. Standing next to a little brook, appropriately, of running water. And this was my issue. My water would not run, and which was very odd. In some ways it was no huge surprise, because I spoke in the other video that I had been on the drug called Tamsulosin, which is loosening the muscles below the prostate to help you pee. And I had been on that, I do believe it was close to 2 years, because of a reduced flow and the fact that they had found with a digital rectal exam, that my prostate was getting enlarged. And at some point, as I had mentioned in the previous video, I did have to go and get biopsies done to make sure it wasn't cancerous. And it turned out it wasn't cancerous, which was good news. And in the previous video, you can find here, it's called TURP Part 1, and this is TURP Part 2. And I do explain how I went through the ordeal I did to discover what happened. And yeah, having the 2 surgeries going on with my gallbladder, and then discovering I couldn't pee. That was not fun. We'll save that to the first part, and this is the second part. It was after about 5 months wait, and of course I was put to the back of the line. I'm a Canadian. Our healthcare system is great. It doesn't cost hardly at all, depending on what you have, for most general surgeries and health things. But sometimes there's a wait, and sometimes you have to travel to get the surgery done that you want. In my case, I ended up being catheterized for 5 months, and I do speak about catheterization in the other video and kind of the details, and I do give some hints too, to maybe help you go through that process. It was a total surprise to me that I was going to be catheterized in the hospital after this surgery, but that's the way it panned out for me. So what happened was, I had the surgery done on January the 2nd. I ended up having to travel that December. We discovered that I couldn't use the washroom or whatever around August, I think it was, August 2023. And I didn't get the surgery because I had to wait in line because it was non-cancerous. I kind of got bumped, and I didn't get the surgery until January 2nd of 2024. What happened was, as I do mention, I got quite stressed by, having these constant change I had to have every 4 weeks or so. I had to have someone come in, the VON, and change the catheter while I was waiting. And yeah, there's more to that experience, as I said in the other video. So eventually my mental health got the best of me, and I called up my urologist's office, and they were all great. They were great, but they're just overwhelmed here in Canada. They have too much to do and too many patients. But they're all great people, and the service itself is great. It's just sometimes the wait. That's in my case anyway. That was the issue. So what happened next was I had to travel 2.5 hours. We found a place to stay, which was provided by my son and his wife. And it was quite cold, it was winter time, and we had to stay. It was too much to travel. It's 2.5 hours from where we live. So we thought, having that surgery and getting out late in the day, instead of traveling there for the surgery and traveling home in a catheter, it would have been better to just stay overnight. So we had a place that we had to stay. Okay, so the surgery itself, I may not have described this in the first video, but what it is, the surgery of TURP, is that the prostate has gotten swollen and grown. And it doesn't just grow outward, it swells over the years in a man. starts in their early 20s, I think. And in my case, I was only 59, and they thought that was kind of young, but that's the way it turned out. And what happened was I had to go this, yeah, as I said, 2.5 hours, and had the surgery, and we stayed there that night. And I did have some complications, and I'll kind of get into that because I want to help you in this video to understand maybe what you're facing, even if things go well, which in most cases they do. I will tell you that I did do the YouTube thing where I Googled a lot on TURP, and you do find some stories in there, horror stories, and it doesn't mean that everyone's a horror story. But there is an element of difficulty involved with it. So the surgery was January 2nd, and what they do is they go in with a tool, a special tool. You're totally under. You don't feel a thing during the operation. You're put, under anesthesia, and you're out. So they take a tool and they go up through the penis into the urethra, and they have this tool. By the way, I did mention in the other video, this may be more of an interest to the guys, in their late 60s or early 50s or whatever, than it is to the lady folk, unless, of course, you're a spouse or a partner and you're looking after someone that is going through this, or you're just generally curious as what happens. So this tool goes in and it removes, we'll call it material, which is basically parts of the prostate on the inside. And I don't exactly know, but you can see diagrams of it, and it's like a little rod thing that goes up and through. And the urologist will basically scrape out with this, and it seems a little crude, but it's still supposedly better than a lot of the other newer ways of cleaning out the prostate or inserting a tube. But you have to talk to your urologist because everyone is different. But from my understanding, a lot of this inserting of a tube that you can just pee past, it often fails, and you're moving around a lot. And anyways, that's something you'll look. This was TURP, and they removed. I remember the urologist telling me afterwards that he had removed, I think, 13.5 grams of material. And I will tell you, maybe in advance, that I noticed a huge difference, especially after everything was all healed up. And comparatively, between all the years, you kind of think, well, I'm just going and having a pee, and maybe a little bit more often, and you're just thinking it's normal because it happens so gradual. I'm talking about the flow, and that's one thing they may give you too. They'll try to give you a flow test, but if you can't even urinate, if your prostate is so closed up, like it was in my case, nothing would come out. Then, yeah, you're going to go through, you're going to have this surgery right away, or as soon as you can. But if you do see these indicators, I would start talking to your doctor, or who will refer you to, a urologist. And then you'll be able to go and have this procedure done. Now, you'll do a lot of Googling, or the urologist may say, and I can't remember what it was, that your healing time was about, before. Okay, I'll explain what the healing time is. When they go in there, they're basically cutting you. Instead of using like a laser or something, they're cutting you, and they're cutting this stuff away. And they're being very precise and careful not to hit anything that's going to continue to bleed. But it does cause bleeding and scarring. And what that means is, and in my case, and I think it's quite protocol, or what you're going to call it, to do it this way, is to have you when your surgery's over, they have a catheter installed while you're asleep. So when you wake up, you'll wake up and you'll see a tube coming out and going into a catheter bag. And they'll explain to you how to use the bag, how to clean it, how to replace it at night, and all this will come on. But in my case, I was familiar with the whole thing because I had been doing this for 5 months, where I had to use a small amount of Javix and water and clean out each bag each night, hang it up to dry, put a new one on in the morning. You had ones that would tie to your leg, and one that would just you'd sleep with, which you'd lay by the side of your bed. I would hook mine over a bucket, and that way I could lay on my back and sleep. Yeah, it was not a great experience. But I got it done, and so that was the second, and then the urologist insisted that I have it taken out right away, as soon as possible, which he said it was about 4 or 5 days afterwards. So 4 or 5, at that point, I think it was the 3rd, we drove home, and I was in a catheter, as I said, and my wife drove us home 2.5 hours, and we had the VON, I had the VON come in, I think it was Saturday afternoon, because that was a Tuesday we got home, or Wednesday we got home. So it was about 4 or 5 days, and they come in and they removed it. Okay, so this is what's going to happen. Almost immediately, you're going to feel a sudden urge to urinate. Because in my case especially, I had been in a catheter for 5 months. So that meant I sort of lost the feeling and the ability to hold it over that period. You don't even have the feeling to go when you have a catheter in you, because it's always gradually emptying from your bladder. So I get home and they take it out, and here's the thing that's going to surprise you. I knew this was happening because they said it would happen, but what happens is you will bleed, okay? Because what's happened is they've cut you, it has to scar, like it has to heal over, so you'll bleed. Now, while you're doing this, and as you know, in the healing process, I'm actually quite tired when I'm filming this, because as you may have seen from other videos, I've been working on my dad's house to get it all cleaned out after he had passed away, and Mom went in a home. And yeah, it's a ton of work. My sons were helping me yesterday. That too is a 5-hour round trip. So I'm a little tired today, but we won't get into that today. So what happened was I started to notice that, I'd go to the bathroom with sudden urges. It started out almost every 10 minutes. And of course, they're telling you to drink. You have to drink a lot, preferably water. So drink, take a lot of fluids. And that's to keep it flowing. And what it is to do is to keep your bladder full, not full, but, so that you will pass out the blood. You're going to see blood. You're going to see blood clots. And I will tell you, as the wall of the inside of the prostate heals, it will shed. I hate to call it scarring. It's not scarring. It's like a bloody gel will happen. And I was almost shocked when I'd go to the bathroom and I'd look down and, I'm peeing over the toilet or into the toilet, sometimes over it, but into it. And you would see, like, in sort of a pink, watery to red urine would come out. And also, even as this would clear up, you'd see, like, what I would call it, the size of almost a minestrone, I guess that minestrone bean, am I saying that right? The size of a little lima bean or something. Yeah, a lima bean, more like it. And yeah, I guess I'm thinking of the soup, speaking of liquids. But yeah, you'd see it like about the size of your middle thumbnail, of size of a blood clot could come out. So that might shock you, because and when it would hit the bottom of the toilet, it would almost form the size of what we have, a coin in here in Canada, the size of a toonie or a loonie. You'd be like, how the heck is that getting out through such a small hole? Haha. But yeah, it's because it's soft and it will come out. And over time, it begins that you'll start to see little drier pieces come out. Now, here's the thing, that I'm a bit of a worrywart about things. And as they said something like, okay, I'm going to quote you a time, I can't remember, it was 6 to 8 weeks before you'd see healing and lack of blood. I found in my case, I may have that wrong, but I think they were favoring the best case scenario, because in my case, and maybe it had been because I had so many catheters going in and out all the time over that 5 months period, wait period. But in my case, it would be, it went on at least 2 more weeks. It's like, I can remember thinking of something like 16 weeks, is that correct? Yeah, or something like that. And it was just like, wow. And at one point, once I passed that point, that whatever they had told me, like a week later, and I was still peeing bits of blood, I'd call them up. And I'd say, listen, is this normal? And it was. It took another couple weeks for me. It did. So that might calm you down if you want to know about it. Is that sometimes it does take a little longer for the blood to stop. And eventually, it was just urine, and eventually, the more you drank, the clearer it got. And you have to keep drinking. The reason you don't stop drinking, you don't want to do that, because you can get something that can happen anyway, and it's called a stricture. It's like a scar. And it is possible for a stricture to sort of grow over the years and begin to close off the flow. So they did tell me, and this is the part that if I let it bother me, I'm 61 now, and it was 59 when I had it, 59, almost 60. And the thing that will bother me is they said 5, 6, 7, maybe 10 years from now, you may have to have it done again. I'm like, oh man. But this time going into it, I will know more about things like how I had mentioned in my first video, how to cope with things like surprise catheterization. I mean, unless you're in an accident or something and they have to do it quick. I do have some recommendations there how to handle that, because it's kind of shocking at first, especially in my case where I basically was in the hospital for something else and it turned out to be a necrotic gallbladder and I had to stay 5 days. So psychologically I had that blow, and then I also had the psychological impact of, wow, I can't pee and they're starting to catheterize me. But I do talk about that in part 1 about how I kind of dealt with that, so we won't get into it here, as this video is getting long enough. So what else can I tell you? I can tell you that over time, even like it's been over a year now, it's since I've had it, yeah, well over a year. And so I do find the increase is very, very good, like in the flow when I go to the washroom. The other uses of said item are still fine and good. Maybe I should be posting that on here. I'll get all these followers. But hey, anyway, I'm a married man, so there you go. So you don't have to have worries about that, unless like you're one of those rare cases that something happens, that surgery, you don't have a good surgeon or something goes wrong. But in my case, I would have done anything to get out of a catheter. So it's the best thing to do, guys. If you ever get in this situation, though sometimes, like you said, you can also self-catheterize too. A person can do that. And I guess some people get too old perhaps for the surgery, and I've heard horror stories of people way up in later in age and they're catheterizing once a day themselves, and I'm like, I don't know if I could do that. I don't know. But I'm not going to worry about it now, because, you know, what do they say? Sufficient for the day is the evil thereof. I guess that's the saying. So let's just deal with what we have to do today. I hope this video has been some help to you. Hope I've remembered everything. Key points are the healing process. Don't be surprised by the blood clot sizes that come out. They're usually soft until they start to shrink, and you see little tiny scabs maybe coming out. You've got to keep drinking. You've got to drink, because you don't want to go through it again. Sometimes you do have to go back and have more done and over again, but just remember the statistics are in your favor. Yeah, so I'm wishing you all the best if you have to go through what I went through. It wasn't fun, but it's much better now. It is much better to go. I've heard one person say on a video I watched, like, he had a successful TURP surgery, and he's like, man, when I go to the loo, it's like I'm 16 again. And yeah, you'll notice a huge difference. You'll probably notice that you'll sleep longer at night. But remember, that muscle, in my case, because I was catheterized so long, those muscles down there were weak, which I guess, I think it's the sphincter muscles. I guess that's what they're called. But you want to practice those two. You want to practice, you know, down in between, so the perineum, I guess it is, in that area. And you want to, you want to keep flexing those muscles and releasing them and practice. I guess I hear that's good for your bladder control and stuff too. You know what I mean? That sense of squeezing muscles down in there to strengthen them up. Anyways, that's enough for today, guys. And I hope you found this video useful, especially if you're in my case and you're a guy and you have to go through this. And I wish they'd find some cause. Even the urologist says, you know, I wouldn't get all caught up in this bogus stuff on the internet about what caused it. They don't know. Scientists really, they know it's based on hormones are creating this, but as far as why it happens, You know, you can't go saying it's because I was exposed to this or that, or there's something in the water I'm drinking or whatever. They really don't know. And even my urologist, he kind of shrugged, and I said, well, is there anything else I can do? He said, well, you know, some people take this saw palmetto and they say it works. It's I think it's some kind of Asian leaf or tea or something that you can look at. It's saw palmetto, I think it's called. I haven't tried it, I haven't taken it, but it's supposed to increase your flow. But I think it will all, you know, there will come a watershed moment, pardon the pun, where you will probably have to face the surgery. And so count on being maybe out for at least 2 months, possibly 3 months if you're working. Try to set that up. That could be hard financially, I know. And because there's a lot you can't do. And get right on it, get right in the system fast, because if you're in Canada, you don't want to be in my situation. Apparently, if you're American, you can get it right away. Anyways, this has been long enough, and we'll talk to you guys in another video. Like and subscribe if you want to hear more stuff about stuff in like for us younger seniors, if that's what you want to call us. And my name is Kevin, and my channel's name is Silver Hill. Thanks. We'll see you in the next one. Bye.